there's a standard test called the Get Up and Go, where that test, the patient starts from a seated position, needs to get up, walk across the room, turn around, come back, and sit back down, and it's timed. And we do that for longevity reasons, not just because are you going to fall.
We're just going to talk about the great news that you just got, talking about Liberty Patch Protect study, and it's coming out July 7th, right? So talk to me. What's going on?
Yes, so we just got IRB approval for a clinical trial, and we are going to be studying the Liberty Patch to see if we already know it improves a person's baseline balance, so we already know that. The question is it clinically significant? So there is a device that they are using in Europe that can actually give a score, a balance score. It's not subjective, it just kinda gives you a score, and then it's highly correlated to whether or not a person's gonna have a fall. Like, in America, we take your age and maybe some other little risk factors, and we say, "I don't know, maybe it's at high risk," and then everyone winds up being high risk.
And then why they're in the hospital, right? Like, they had this, something happened to them.
Yeah, my favorite is when you've got a perfectly healthy 23-year-old that's high risk and they're not really high risk, with just it's on the door. And the issue is you can't do anything proactively to prevent a fall necessarily. You can only identify the person who is at high risk for fall. And just for perspective, 1 million people per year in America will fall in a hospital setting. 100,000 of those people will actually injure themselves as a result of that fall, and 10,000 people will actually die as a result or in the 2 weeks within a major fall. So, like, people die because
Remember, it's a million that they've actually documented.
yeah, that's what they've documented, which means
So what do you think? What do you think? How many people have had the?
right,
Have
did
that?
they really fall? I don't think well, so the thing the
You know,
hospital,
it's a lot of paperwork.
that's a
I
lot of
think they caught
thank
themselves.
you. That is a lot of paperwork. And the hospital gets dinged when the more falls they record. So look, they don't want to record these things. And if someone falls, it's not just paperwork. Now in the modern era, because everyone's so worried about lawsuits and whatnot, you got to call the trauma team to the scene and all kinds of crazy stuff. So it's like, look, nobody wants you to fall in the hospital setting. We frown upon strapping people to the bed, but trust me, some people we do. Anyway, and so the question is, what does one it's a serious problem. 10,000 people per year are going to die as a result of a fall in a hospital setting, and we don't have anything proactive that can keep that from happening. So what we'd like to know, because there is a device that can give you like a corollary, like this person is gonna fall, if we can see a difference, and we don't know if we can or not, if you can see a difference in a clinical reading on that particular biometric, then you stand a chance of actually proactively preventing a fall. Now, we have studies um, of surveys that people have taken saying, yes, this really helps me. And you can do a physical exam that shows, yeah, the patient is certainly more stable, but that test is done in a standing position, not in a walking position. And typically these falls will happen because the person is in motion, not just because they're standing. So that's the question. We've not tested this patch in motion. And so that's what this test, what the study is for. And so we just got approval. And so for 1 week, July 7th through 11th, we will be doing intake exams on patients. Then we send them home with 7 patches, either placebo or controlled. We don't know. You get randomized and you wear a different patch every day for 7 days. And then you come back and we test you again. So from the 7th to the 11th is test 1. And then from the 14th through the 18th is your test 2. Test 1 takes maybe
And whatever you were given, if it was real or they call it a sham in our world, uh, then it's going to switch.
We're not gonna switch. We're not gonna do the crossover study, I don't believe. I think I think we're just going to stick to straight data,
2 weeks, 2 weeks straight data.
2 weeks straight data. I don't think we're going I'll have to ask Peter, but, because we did talk about possibility of doing a crossover, but now you'd have to have that group come in a 3rd time, and I'm not unwilling to do that 3rd data set if the crossover group agrees. So, like, at the end of the day, if we say, "Okay, well, you were really placebo, do you wanna try the real thing and come back in 2 days?" or whatever, you can do that. I don't think I'd wait for 2 weeks.
Because you should have a more.
We'll see the effect in a standing person, you see the effect within a minute.
I mean, my sister was me just, down on the beach asking the question, right? I mean, it was immediate.
Is immediate, so we do test it immediately, so we're gonna do 1 test, no patches, 1 test right after putting a patch on, and then wear it every day for 7 days. That it would be interesting to see if those numbers are different. If immediate, put the patch on versus I've been wearing it every day for 7 days, is that number any different? I don't no one's ever tested that. So so we're gonna test that.
Up, down, right?
Right. So I'm not opposed to having the and we may record that just for funsies, just to have the data. So just on that very day, they come in for
I'm
their
bringing
walk
I'm bringing
across.
my gear, and we're just gonna push
Yes.
play, and
Yeah.
we'll edit it out
Yeah.
to look at all the little snippets and
Yeah.
so the 3 tests that they're doing there, right? It's a stand up, it's a get up from the chair, right?
It's based off of the standard, there's a standard test called the Get Up and Go, where that test, the patient starts from a seated position, needs to get up, walk across the room, turn around, come back, and sit back down, and it's timed. And we do that for longevity reasons, not just because are you gonna fall? But grip strength and the get up and go time are directly correlated to longevity.
Yes, and they've done the studies where they talk about speed of your walking is directly.
So someone who has like an uneven gait, the stride has different lengths, that person's not only at high risk for falling, but that also correlates with a decreased life expectancy. So anything you can do to make a person more mobile and even up their balance and straighten out their stride, you are going to increase that person's life expectancy. And of course, our goal is not to prove that point. That's a 30-year study. We just want to say, hey, if you get admitted to the hospital, is there something that I can do to keep you from getting up in the middle of the night to use the restroom and falling and hitting your head? That's the most important question to me. It represents millions and millions and millions of dollars per year in the healthcare world. You can save a lot of money with a $2 patch is what it boils down to, and save a lot of lives, I'm hoping. We'll see. I mean, we don't know. I'm blinded to I don't know who's gonna have what patch.
Right.
At the
They look
end of
identical. One has the pattern,
they
one
look
does not.
identical. It's gonna be at the end of the study, we can unroof whether the person was on, placebo versus test, and if they've been on
That's the fun
placebo
part.
yeah, and if they've been on placebo and they wanna see what their numbers would be with a test on, then we could do that and just gather more data on that same day, so I'm happy to do that. That'll be fun.
So, July 7th, it starts, but right now you're sending this out to.
So my office is in North Texas, so you'd have to be in the Mansfield, Texas area for a 7-day period of time. Number 1. Number 2, we want those patients
You gotta be able to drive in twice, right? So even if you live an hour away, hour and a half, whatever.
exactly, you gotta be able to get to me twice, and you need to be between the ages of 55 and 85. You need to be able to make your own cognitive decisions. So if your mom is 80, but she's had a stroke and you sign for her, that's not really the person that we want. So because they have to, all human clinical trials, the the subject, the person, has to know what we're doing and sign a consent. And so they have to understand the study. There's almost zero harm. I mean, other than you walked into my place, that's the only risk to the test. This Band-Aid does not represent a stress to the patient. So it pretty easily made it through the IRB process. But anyway, so yeah, so that's the study criteria. The first um the first testing period will take less than 30 minutes. The second testing period will probably take less than 15 minutes. I have sent out emails to all of my patients. I've posted it on our Google page for the doctor's office. And then I've also put it on my website and my social media. I do have med spa clients that are slightly different from my office clients. So their email will go out here probably in a couple of days to the med spa. And I need to announce to them that I'm closing down the med spa anyway. So most of them know it, but I might as well make an official announcement to those people. But anyway.
Well, your Amsella chair is
Oh,
still
it's
available.
fired up and still cranking, yeah, absolutely. And then a plastic surgeon in town is buying some of my other equipment, so no one fear. My nurse practitioner is still doing the weight loss and injections and hormones and all that, just in a different location. You will all be
Just
cared
down
for.
the block. Just
Yeah,
down the
but
block.
different people. Yes, different people. My focus is now going to be I sit on the medical board for a super patch, and they want me writing papers, designing studies. I am a surgeon that's joining a hospital. I'm going to be a hospital employee, and that way I have help in the care of my patients, less paperwork burden and
You have a
management.
new physician started with you, right?
Yes, so she'll be joining in about a year, and we'd like to recruit some junior partners to sort of build out the colorectal department. And then the med spa is taken over by the nurse practitioner, changed names and all that kind of stuff. So we're winding that process down. And then it's just me doing the online social media thing and wellness platform and my gut check subscription and that sort of thing.
So what's the goal? How many people are you trying to recruit?
We would like to have 100. There's a second location of service in Florida, and I don't know exactly where, but there is a second group in Florida. But we want 100 in our group, and if we have enough interest, we'll do more. The more the merrier. But the more that we can do, the less the Florida group has to worry about. So
And so, if someone is selected or, does fill out all the necessary paperwork and says, "Hey, here's your invite, here's your time slot," what do they get for that?
yep, the ebb and flow is basically this through a personal invitation email, come join us, or on my Google page, or on my website, or on social media. There will be these more info link buttons. And if you want to look at a landing page, it's DRTOKER, drtoker.com/protect. And that will get you the landing page to the study. You can read through what's involved, what we just talked about. And then there's a yes, sign me up, I'm in. And that will get you to a calendar page where you can pick and choose your own slot. You only choose, yep, you only choose your first slot. We will give you the follow up. That way it's done exactly 7 days apart. That way we don't screw that up. Once that happens, you're gonna have to leave your email. That way we can communicate through email. The email for the study is drtoker.protectstudy@gmail.com. So we set up a new email for this process. You'll get an email from that account to you that will be an introductory email. Thanks for joining. It will have an introductory video from me, which is sort of like your informed consent in person through video format. There will be a consent form that is sent to you through an official online signing process that is HIPAA compliant and to protect your privacy. And then there's an intake questionnaire and there's an outgoing questionnaire. and I'd like to get those digitized to go through that same form signing thing. That way, again, it's all your private data. No one has to know what it is, and it goes directly into the study um, file,
Yeah, the database.
the database that the statisticians are going to use. And so I'm blinded through the process. So I don't get to see any of this data. Somebody else is going to have that kind of information. Everybody's name is going to be hidden. And so everyone will get a study number, subject number. And it's going to be your first initial, your date of birth, your last initial. That's your study number. And you'll get randomized to either placebo or controlled. And my role is to make sure everyone has informed consent. Everyone has signed that consent before we do any testing on them. Otherwise, that's like a Geneva Convention breach. We don't want to do that. And then somebody else is in charge of the statistics. I will start writing sort of an introductory paragraph and whatnot, but we do have a team that will put together sort of the results and the discussion. Once that's been written by an independent team, I get to read that and then I can make a conclusion. So I'm the intro conclusion person. And then, of course, you and our nurse practitioner, Patrick Sherlock, are going to be sort of the assistant investigators who are going to help set up these studies, coordinate things, and just make sure I don't screw up. Slap
There we
my
go.
knuckles, make sure we do it right.
That's it.
I
That's it.
want this. I want the study to be bulletproof so that there can be no naysayers. So we need to have statistical power. We've already done all that kind of research, like how many people do we need? We found the right device. I'm going to be practicing with that device in the next week or two on everyone I know is going to get this test to make sure I know how the device works. How's it hot syncing? Where does the data go? How do I get that data into our data bank? That sort of thing. So it's a process.
So all that being said, I get selected. Let's talk about what do they wear the day of the test, right? So shoes, clothing, right? You want to be what you want to be in shoes you can walk in. You don't want to, got love the ladies of Dallas. Don't want to show up in your 4 inch
No,
suede
no, and the
shoes.
people in Dallas will do that, right? They'll dress to the nines. Don't do that. I mean, keep in mind this. We're looking for hospital setting. I'm not saying show up with your cheeky buns hanging out the back of a exam
Not that
gown.
hospital setting. Not so.
Not that comfortable.
Eh,
Not that. Not that free balling, but comfortable shoes, comfortable clothes, because you're gonna sit down, stand up, walk 12 feet, turn around, walk back, sit down. So it's not exercise, but you're gonna be we wanna test mobility, your gait, you know? And just think of yourself of like, "Look, I'm not feeling well, so I'm just gonna walk there and back, and that's it." Just like you would in my office or something else. So don't get dressed to the nines. No heels, no dress shoes, just comfortable shoes.
I say that.
Gotta say it. I will remind
Okay.
people.
Well, listen, I'm excited. I know you're excited. We're going to get this out to a lot of people, and hopefully, we have a great response. And they get $25 uh, little little gift card
They get a $25 gift card to Amazon, and then I have an online webinar platform that I will there's a couple of different programs, and everyone who signs up, if they complete the study, they will get access to that as a free program, and each of those have a monitor.
because that's worth what, like 200, $350,000. I mean, think about how much was your education? Half a million.
You know what I'm saying? And 20 years of experience, come on now.
I mean, that's millions of dollars
Mm,
worth of intellect, right? Priceless. You're gonna
so
have people standing outside the door. I mean, it's just when they hear that they can get access to
yes,
that
just to
knowledge,
me, just to me. Correct.
gonna be
Yeah. So we'll give them access to the online program. We'll give them a month or 2 free to our subscription program as well, so they can get a taste of that, and there you go.
they're gonna be smarter,
Yeah.
better balance, better
and a
mobility,
$25 gift card to Amazon. You can't go
and
wrong.
a little bit wealthier.
Yeah, a little bit wealthier for not
All
much
right,
time. Not much
for
time.
not much time.
No. Mm-mm.
Stand up and
We'll
go.
have we'll have refreshments, and we'll make it fun. It'll be good.
It'll be
So,
great.
yeah.
It'll be a good
Yeah.
time.
It's gonna be a great time. Mm.
Mansfield, in beautiful Mansfield.
In beautiful Mansfield.
Look forward to it. Dr. Toker, as always, a pleasure, and look forward to having you on the program here in the next week or so.
Thank you for helping us put the study together, and then also thank you for advertising for us. That'd be amazing. If any of your audience is in the North Texas area, come join us.
Come on, it'll be a good time. What day is that you're doing it? Is that
Monday through we have slots Monday through Friday,
okay? So
July 7th
Monday
through
through
11th.
Friday.
Right, so if you wanted a Tuesday slot, that means you'll get the next Tuesday as your follow-up. So just keep that in mind. So you're not gonna be able to do, "Well, I can do Monday this week, but Friday next week." That doesn't it has to be 7 days apart.
Tuesday, Monday.
Yeah, Tuesday, Monday. We'll try to have a full day of each of those days, a little bit early morning, a little bit midday, a little bit late afternoon. I've got 2 college pre-med students that are gonna help us, so there's plenty of assistance. Everyone will be trained on this. The technology is very easy to understand, so it's pretty simple, to gather the data.
Awesome. Look forward to it. And
Yep.
until next time,
Yep. We'll see you.
we'll have you back here on the VNEW Health Podcast.
Yes, sir.